Well, as we mentioned, with the recent rise in COVID hospitalizations in the state, is it a cause for concern?
After weeks of modest numbers of new cases over the last 2 weeks, cases have jumped back up to over 1,000. Now joining us is Dr. Scott Miscovich. He's the president and CEO of Premier Medical Group. Dr. Miscovich, thanks for joining us tonight. Good to see you again. It's been a while.
Yes, good to see you, Rick and Mika, and it has been a while, I guess, which is good news, but
right.
We have a little concern right now.
Yeah, and speaking of that, so we mentioned at the top of our newscast, why are we seeing this recent rise in COVID hospitalizations, and should we be concerned about it?
The answer is, should we be concerned? Yes. Should we be over-concerned? Not yet. And the thing that's bothersome is we don't have a good answer. There are a few answers right now, which is, we're getting a lot of people pushing the spring break push, but we don't buy that. The single biggest thing we're seeing right now is waning immunity. And, what I wanted to make a point of right now, we have less than 20% of our population has had the new bivalent vaccination. Right now, that means about 80% of our population is not adequately vaccinated because there's such waning immunity over time. And the old vaccination really doesn't cover Omicron like we are concerned. So that's something that's very concerning. Now, the final thing is when we study what variants are in the state, that's about 2 to 3 weeks behind. So we're very much going to be watching to see if we have a new variant that's popping up. And we have two of concern, a big one in Singapore and one in India that are really taking off. So there's a few things out there. So there's multiple reasons, but we have no real good explanation right now.
Would you say maybe the recent surge in hospitalizations, or uptick, I should say, not surge, uptick in cases and hospitalizations, just a normal progression for this disease?
Oh, no. I would definitely not say that because of where we have been, Rick. We've been hovering down in those numbers, and you guys are both very, very well versed in COVID with all the time we've spent together. There's that number called percent positivity. Well, we were, down well below 5%, which is a really good place to be, showing that the disease is not really spreading that much. Well, now we're up over 10 and 12%. And, that is a concern that a number of people that have the disease and how many each one is spreading to is really increasing. So no, this is a significant issue to start watching. And, I can't emphasize enough, it's really in our hands as a population. We're the ones that are going to do something about this.
And finally, to wrap it up, speaking of doing something about it, we are expecting an updated recommendation on the bivalent booster soon. So what do we know about that?
Yeah, that's going to be a biggie. Right now, we already know it's going to happen, but basically the FDA's already leaked and it's approved that the bivalent is now going to be approved for 65 and older, and anyone with at-risk conditions, immunosuppression, obesity, lung disease, etc., chemotherapy, every 6 months, because we're all coming up to that window where people started to get it September, October, November, and they're due for the boost. We know at 4 months it starts to wane the older you get. This is really key. The 60, 70, 80, each of those age groups is where the death and hospitalizations are occurring. Each one has a higher percentage. So if I have any message for our population, if your kapuna have not been vaccinated, get them vaccinated. That is the number one thing you're going to do, as well as wear a good KN95, not a cloth mask. And finally, which is not well publicized, get Paxlovid if you are positive. That gets you a 90% reduction in hospitalizations, and of course, get tested.